So welcome back, everybody, to your tables. And my name is Tabinda Sheikh. I am a policy analyst for the Corporate Policy Shop at the Department of Health and Wellness and a proud Diversity Committee member. It's my pleasure and honor to invite our next three panelists for the morning session. Dr. David Haas. Dr. David Haas is a professor of the Department of Medicine and Division of Internal Medicine at Dalhousie University. He's presently a member of the African Nova Scotian Advisory Committee to the Dean of Medicine. He's also the co-chair of Canadian in Health Research. I don't know what CIHR stands for, but Institute of Health Research. Thank you, Sharon. HIV Trials Network Prevention and Vulnerable Population Score. African Canadian Black Working Group, interim co-chair and member, Canadian HIV/AIDS Black African and Caribbean Network, and co-president of Health Association of African Canadians. I would like to invite Dr. Haas to please come up to the podium. Our next panelist is Anna Jacobs. Anna has been working at the Capitol Health for 10 years as a community health board coordinator, and more recently as a community development advisor, diverse communities. She has a master's in adult education and community development and is a volunteer board member of the Health Association of African Canadians. Welcome, Anna, and I know that Anna has two hats on today as the coordinator of the Community Health Board, as well as her other role as the Community Development Advisor. Welcome, Anna. And our third panelist is Regine Boudreau. And please pardon me if I'm not pronouncing the names right, because I know how that feels. so anyway, that's good. Regine, okay. Welcome, Regine. Regine is a recent graduate of Dalhousie School of Social Work and is currently the outreach social worker for the Association of Black Social Workers and the Acoma Family Center. She's also a Master's of Social Work student. Regine has done much community development work around social issues pertaining to African Nova Scotians of all ages. Some of her work has been around the topics of Afrocentrism, violence, healthy aging, intergenerational restoration, youth mentorship, and family learning. Regine is a member of numerous committees and networks, including the African Canadian Health, in which she co-chairs. Welcome, Regine.
Hi, good morning. It's still morning, right? Yeah, and you're all here still, so that's a good thing. Just want to thank the Diversity Committee from the Department of Health and Wellness for, inviting me to be a part of this panel. And I want to tell you up front that I'm really not the person you see here. This should have been Donna Smith Darrell, who's the other co-president of the Health Association of African Canadians, HAC. But unfortunately, she could not be here. So here I am. You'll put up with me. My task really is to outline a little bit of our philosophy, and then to just to provide you a few examples of our collaborative work. And we've been asked to kind of highlight some of the issues that we've had. So we're a nonprofit organization, and we're committed to the vision of having thriving, healthy African Canadian communities in Nova Scotia. So we firmly believe that working in conjunction with other like-minded organizations is a key thing. And in fact, in our terms of reference, we've embedded the 7 principles of Kwanzaa, which includes, as many of you will know, Ujima, which means collective work and responsibility. Since our inception in 2000, we've worked hand in hand with many partners on collaborative projects to enhance the health of our Black communities. So the question is, are there challenges? And you heard the discussion by Lynn and Jill. And yes, there are many challenges, and everyone in this room knows that there are challenges. And I just want to mention a few of the ones that we have seen over the years and just talk about basically how we have kind of moved through them. One of the big ones, of course, is time restraints. You have people who work in different locations, different organizations, different agendas, and it's always a challenge to get together, to make plans, to do collaborative work. Another one is self-preservation. So, you know, the notion that some of us have at times when we get into collaborative work is that we're going to lose ground to another organization. We're going to lose some autonomy or something else in some way. And of course, the big one is lack of resources, because oftentimes you need to share resources when you're working together, and many of us have very scarce resources to start with. So some of these challenges we have worked out by having a willingness to work together, often including some sacrifice. So if you know that you need to get together with another organization, maybe you will need to sacrifice something else in terms of time to sit down and make plans. We have to be very patient, and we have to be open as well to share our ideas and to share our information and to build that trust, which you heard about before. We also have to have a willingness to share our resources and also to work together to apply for funding, recognizing at the end of the day that the goal is all about the community we serve, and it's not really just about us. So let me share a couple of examples of collaborative work that we've been involved with. So at the IWK, there's a Diversity and Inclusion Council, and that includes representatives from many diverse community groups, including HAC. And one example of their work is they had a community conversation in February 2012 in North Preston with a number of the members from the Black community. And out of that, they had a discussion about mental health programs. Capitol Health also has a similar Diversity and Inclusion Council, which again includes representation from diverse communities, including HAC, and departments at Capitol Health. Their work also includes many things, and one of the things that I highlight to you is that they have an employment equity plan, which is in development, where they're going to be supporting people of diverse communities who are applying for jobs at Capitol Health. Both of these councils are committed to enhancing diversity and cultural competence in their respective workplaces. My final example is the visit of Dr. David Williams, who came here in February. He was here the 10th and 11th of February. And Dr. Williams works at Harvard University, and he's a world-renowned expert on the issue of racism and health. I must say he worked very hard when he was here. I know he was exhausted at the end of the day. But he made several presentations, and we really appreciated his presence. And I think his presentations, it's fair to say, were well received. He presented to a broad range of persons, including health professionals, university students and staff, Department of Health and Wellness staff, Capitol Health executives, and to the community as well. His presentations were shared by telehealth and live internet streaming, and almost 1,000 people were in attendance at these presentations in some form or the other. So we managed to reach a wide range of audiences. And in fact, we will have some of his material available on the HAC website for future reference. But I want to tell you that this visit of Dr. Williams was achieved by a wonderful collaborative effort. Included Cancer Care Nova Scotia, Capitol Health, Dalhousie University, and HAC, and we had funding provided through the Department of Health and Wellness. So, you know, we just thought it came together so nicely. And we had those kind of issues that I talked about before. Willingness to get together, we had to make sacrifices, but at the end of the day, it came together, and I just look back and think it was just wonderful. So what I've given you here is a very brief snapshot of our collaborative work. So we're very firm believers that together we're stronger and better than when we work alone. So I've given you some illustrations of our working together. It's more beneficial for us and the community we serve, for sure. And yes, there are challenges when you undertake collaborative ventures, but these can be overcome. And I would certainly encourage everyone to look carefully at the work they're doing in that light. So thank you very much for having me here and for our time together. And I do look forward to ongoing collaboration.
Good morning, everyone. Excuse me. Before I start, I want to say thank you to the Diversity and Inclusion Committee for having me here today. I'm a big fan of these equity forums, have come every year, and so I'm really pleased to be speaking here today. A couple years ago, Capitol Health did its first ever diversity survey of its staff to see how representative the staff workforce was of the community. And we found out that we're underrepresented in the African Nova Scotian, the Aboriginal, peoples with disabilities, and immigrant communities. So, and we want to be representative of the community because we know that if we are representative and we have a diverse workforce, that we have a diversity of ideas, of perspectives, and can provide better care to our communities. So, over the last couple of years, there's been a team of people working on an employment equity policy. Many are here today, Mohammed and Cheryl and Susan. And this fall, we launched the employment equity policy. And so it's great to have an employment equity policy and to do some education within the Capitol Health system. But in order to reach the 4 communities that have been marginalized for many years, we need to do outreach. And so that's what my job has been for the last number of months. I've been very privileged to have this part-time position, which started in the fall. And so what I want to share with you is just a few examples of how Lynn was talking earlier about kind of the what did she call it? The collaboration continuum. And so for us, we're really at the conversation part of it. So finding out the exploratory process of a collaborative process. And so I just want to share with you some of the things that we've learned in our initial conversations, which will help us to become more culturally competent and have a diverse workforce. With the Aboriginal community, we connected with the First Nations, the Native Friendship Center, and we chose to connect with them initially because they are a very inclusive organization. They welcome non-status, status, First Nations, all nations, the Métis, the Inuit. And so they also have a fantastic employment center. They have staff there who have been working there for decades and are very competent in the area of employment. So we had a few meetings. Our director of HR met with some of their staff, and we had some excellent conversation about what are the barriers for the Aboriginal people to find employment within Capitol Health. And one of the key things I learned, and I think it's a good learning for Capitol Health, is that for the Aboriginal community, they like to know what jobs are going to be available 2 or 3 or 5 years down the road. The community has experienced too many times being trained in certain areas, and by the end of the training, there's no jobs available. So that's a great learning for us. So Capitol Health is going to come up with some projections of where jobs will be down the road, and then we'll work with the community to help members of the community become trained in those areas. With the people with disabilities community, I've had the great pleasure of working a little more closely with Charlie, and through his advice and some conversations with Charlie and several others in the community, we decided to connect with Teamwork Cooperatives, which again is an organization that provides excellent employment opportunities, employment services for members of both the mental and physical disabled community. And so again, we had some meetings with some of our executive staff and staff at the employment center. And again, in our conversation, came up with all kinds of ways that we can begin to work together. We've shared job postings of those positions that have high turnover within the organization. But something that we learned in that conversation was that they have some excellent resources on staff, job coaches and job supporters who can come right into a workplace to accompany the employee into the workplace and work with managers. And so, as Charlie was saying earlier, managers do have fears and stereotypes and myths about the challenges of having someone with a disability working in the workforce. So knowing that teamwork has that staff person who can work directly with the employee is a great benefit to Capital Health. The African Nova Scotian community, I've been working with the community for a number of years, well, about 10 years, and particularly in the communities of Cherrybrook, North Preston, and East Preston. So I have some relationship with the community. Over the years, I've been hearing that there are very few Black health professionals. And so in collaboration with the Community Health and Wellness couple staff from the Centre in North Preston and the Halifax Community Health Board through Shalina, who's here today, we organized 2 events, which we call Striving to Build African Nova Scotian Health Professionals for the Future. And we meant to have just kind of small gatherings, but they've turned into, we've had 2, one in Halifax and one in Dartmouth. They turned into large events. We had about 150 students come to our events to hear from Black health professionals who are currently working in our system. And it was an opportunity for the students to hear about the variety of jobs within the health system. And several of them told us that they thought about working in health meant either being a doctor or being a nurse. And so through these events, they know that there are so many other areas of work within Capital Health. And 61% of the people who completed a quick survey said that they would definitely consider a career in health as a result of our events. And with the immigrant community, we've connected with ISIS and ADAM, the African Diaspora Association of the Maritimes. And Capital Health has had somewhat of a relationship with ISIS already, doing some tutoring around interviews and resumes. But what we've heard in the conversations with those 2 organizations is that many of the immigrants who are coming here to Nova Scotia have education in a health profession. What the immigrant community is really looking for are placement opportunities, so they can get that initial Canadian experience. So we'll have a conversation in Capital Health down the road about how we can facilitate some of that within the organization. So just some of the successes that I've had really is that both parties, I'm wrapping up. So both parties, I guess I've been kind of the bridge between Capital Health and the community, and I've had a lot of support from both sides. Executive staff in Capital Health have been fantastic, and support from Mohammed and others. The community organizations have been very welcoming. And just, I guess, for advice is that to start small, to learn about the communities before you make some connections. There are some amazing literature out there to give some historical background on the communities. It is challenging work in that it takes a lot of emotion. It's much more emotional work than sitting at a desk for 9 to 5. Lots of pain, lots of anger, lots of emotions when you think about how we've marginalized the communities for so long. But collaborating is definitely the way to go. If we are to reach employment equity, health equity, then the only way we can do that is through collaboration. Thank you.
So again, thank you for inviting me to come speak on the African Canadian Health Network. And I am a co-chair with Donna Smith as well. And so the health network actually formed in September of 2011. Really, it started with a discussion with Anna, Donna, and a lady, Mandy Magan, about the small-term or short-term programs and projects that were going on in regard to health in the African Canadian communities, and how, once they get rolling, the funding runs out, and then what do we do? So it was really about how can we bring organizations together to collaboratively work to try and get sustainable projects going and also longer-term projects. So from that, they decided to hold our first meeting, which was in 2011. And Great, thank you. Perfect. And so the meeting was really about learning what are the strengths and challenges in working collaboratively. And so there was different organizations that were working in the health professions who came to this meeting. And through the meeting, there was some challenges that were identified, such as lack of trust, relationships with communities. How do you work with certain communities if you're not looking like them, type thing. The lack of programs that are in communities and how do we get them in there. Also, lack of evaluation of the different programs. But there was also opportunities that came out of that meeting as well. And one of them was to continue meeting as a network. So this, when they started with this meeting, it wasn't planned to be an ongoing thing, but that's what it turned into, and we're continuing to meet today. We meet every 6 weeks. We'll meet for 2 hours and have different organizations come. It's open. There's no membership or registration form, anything like that. It's just really a network where we encourage people to come. So some of the organizations that have been involved or are part of the network as of now, they're listed there, but different representatives from the community health boards, the North End Community Health Clinic, HAWC, which is the Health Association of African Canadians, ABSW, the Association of Black Social Workers, Halifax AIDS Coalition, Canadian Diabetes Association, Mount St. Vincent University, the Community Health and Wellness Centers, Mental Health and Addictions, Department of Health and Wellness, Seniors Mental Health, Tyro from IWK, and different students. So we encourage students to be part of our network as well. And currently we've had many students come, and we have a student that's working on our newsletter, which we put out 3 times a year, which is right here. So I just thought that I would put a picture of what it looks like, but it gets circulated. It's available for anybody that wants to see it. And like I said, it comes out 3 times throughout the year. So in 2012, we did an evaluation. So people of the Health Network were encouraged to do an online survey just to kind of evaluate how is the network going? Are we really sticking to what we first sought out to do with the network? And some of the highlights out of it were, in total, respondents said 32 connections were made this year around the table as a result of the network. 75% of the respondents said that the African Canadians are more connected to their services as a result of the network. 67% of respondents said that they have developed new approaches to their work as a result, and 88% of the respondents say they have developed professionally as a result of this network. So if we think about collaboration and what we were trying to do by getting involved in the community and work together, it's evident that that's what was happening. These are just some other highlights. As a result of attending network meetings, they have made connections with other organizations, as well as in the African Canadian community, and collaborated with other organizations. This has led to new ways of providing information and delivering programs, as well as raising awareness and professional development. There's also been connections made over the past year that have helped people of the network connect with other organizations who are around the table as well. The network has provided representatives with opportunities not only to connect with other organizations, but to collaborate on projects together. And we have a couple examples of these, but are in the works of having some more examples. One is a faith-based program that was offered at Cornwallis Street Baptist Church, which was a collaboration between mental health and addictions, prevention and treatment services in the Cornwallis Street Church. A second was a joint funding proposal to the Lawson Foundation for Diabetes Management Program, and the Health Association of African Canadians, Association of Black Social Workers, Canadian Diabetes Association and the North End Community Health Center, as well as Mount St. Vincent University and the Southeastern Community Health Board all worked to put this proposal together. Unfortunately, it wasn't funded, but still the collaborative piece of working together to create the document, create the proposal in order to get funds so that we could together implement the program that we proposed within the community. This is just a quote that came from the summary. A great benefit of the network is the updates on projects from the people at the table, as well as the opportunity to work together on projects. So right now, we're in the midst of completing another funding proposal collaboratively to get some funding for a diabetes train the trainer type program. And so really it is a joint initiative in creating the proposal together, and then it will be implemented collaboratively as well. Again, some more highlights. People are more aware of the needs of African Canadians, which is also a great outcome. And a change that we heard was that we can do more in terms of including community or going to community, because usually when we were meeting, it was at Anna's office, which is not specifically in a community, but it was suggested that we go into different communities so that they know our presence, they know we exist, and so we can make connections with people in the community. So just a couple examples, we've been in North Preston at their health center, and that has helped with our relationship with people in that center, as well as the East Preston Family Resource Center, which again has strengthened that relationship as well. And we've also met at the Adam office. And this is just an example of what our evaluation, or our first, our evaluation results. So I just wanted to show you kind of what it looked like. This is available too for anybody that would like to see it. But really, I've been co-chairing the network since, I think, September maybe of last year with Donna. And I started attending the meetings through my work as a student, but then when I got employed. And I just really enjoy being on the network. It's really a good opportunity to learn about what everyone is doing in regard to health with African Canadians and African Nova Scotians, as well to really build those relationships, as we know is very important, so that we do work together to serve the needs of the community the best way that we can, and not have people, doing the same thing but not knowing about it. So it's really about growing that relationship and being able to collaborate and do things together, because there is power in numbers. So thank you very much.
Okay, so the community health boards, there are, community health boards are the ears, eyes, and voice of community. There's 37 of them across the province, and they're legislated by the provincial government. And there's two mandates, well, there's more than two, but the two mandates that most people are aware of is producing a community health plan, which is the result of some community conversations to hear what the priority issues are. And the second is through community development funds or wellness funds. But community health boards play a larger role than just those two things. We are engaged in community projects to address health equities. How many people here are actually from community health boards? Can I have all the volunteers stand, please? And maybe just holler out where you're from. Can you just kind of holler out which board you're from or which area? Starting with Sherry and Jan down at the back. Oh, okay, great.
Okay.
There you are.
Southeastern Community Health?
Guysborough County.
Shelburne County.
Dartmouth. Clare Community Health.
Lunenburg County Community Health. Southeastern. Halifax Community Health Board.
Halifax. What's that? She's getting her exercise, yeah.
Toronto area.
Excellent. Thank you. Good representation here. So health equity is definitely on the radar of community health boards, and I'm just going to share with you a couple of examples. I did send an email out to the coordinators across the province to see what's happening regarding these issues. So, but just to say it's on the radar, and in last September or last fall, we had a conference in Truro, and health equity was one of the key themes. Our community development funds and wellness funds, as they're known in some parts, have funded many projects that address health inequities. But some of the collaborative initiatives that take place are, and I'm going to read the next couple because they were sent to me. In Pictou County, 2 community health boards partnered with the Pictou County Health Authority, Dalhousie University, and the African Canadian Aboriginal and immigrant communities to assess the knowledge that the communities have regarding available options for palliative and end-of-life care and their experiences. They did focus groups in each of the communities and came up with recommendations in 4 areas: community education and information, professional development for Pictou County Health Authority staff, policy, and the 4th one is practice changes. The recommendations have been accepted by the Pictou County Health Authority and have been built into future planning strategies. They have already started to implement some of the recommendations. And in fact, at an upcoming palliative care course, 10 people from the 3 focused communities have registered. The authority is now having early discussions about having a palliative care course in Pictou Landing itself. In Cumberland County, the CHB has partnered with Public Health on a Just Ask campaign, a campaign to address the underutilization of children's oral health program covered by MSI. The Just Ask campaign was designed based on information obtained by an oral health information exchange that was hosted by the community health boards and is to empower families to ask about what dental services are covered under MSI, as cost is a major barrier for many, especially marginalized communities. They developed Just Ask posters that were distributed in community locations, including dental offices. And since the start of the campaign, there has been an increase in oral health professionals and dental office staff's awareness of and sensitivity to the fear that families have of asking about coverage. As a result, there have been an increase in number of people asking about MSI coverage. So that's in Cumberland County. In Capital Health District, the community health boards also have been working collaboratively to address health inequities. It's one of the 4 recommendations that is in the most recent community health plan that was delivered to Capital Health Board of Directors and executive staff last December, and I have a copy of it back there if people want to see it. So it's one of the key recommendations, 1 out of 4. And the community health boards, 7 community health boards in the district worked collaboratively on developing that plan. In Chebucto West and Halifax Community Health Boards, they're both working on, with ISIS and other organizations on the annual Multicultural Health Fair that's taking place later this month. The Halifax Community Health Board, as I mentioned earlier, was a partner in our striving to build African Nova Scotian health professionals for the future. In Sackville, the Community Health Board and other organizations are working to address transportation issues, and in West Hants and Uniacke, the CHB advocated a couple years ago with community organizations for improved transportation, and now they have a bus that runs from Windsor and travels down the valley. The Southeastern Community Health Board, which is the one I've coordinated for the past 10 years, many people think it's in the southeastern part of the province, but it's not. It's in the southeastern part of Halifax. It includes the communities of Eastern Passage, Cole Harbour, Cherrybrook, Lake Loon, North Preston, East Preston, Lawrencetown, and Mineville. So the Community Health Board a couple years ago wrote a letter to the government advocating for more resources for the Community Health and Wellness Centre in North Preston. And the centre now has a part-time physician, 2 part-time nurse practitioners, one full-time nurse practitioner and a nurse. The Health Board has also, I think we're into our 4th or 5th year of organizing an event on March 21st to mark the International Day for the Elimination of Racial Discrimination, taking place on March 21st again this year at the Black Cultural Center, if anyone wants to come join us. And we've been collaborating with the schools, the elementary schools and the junior high schools. We invite the elementary school students to draw pictures of what our world would be without racism. We invite the junior high students to perform songs or read a poem or do a dance that sends a message about eliminating racism. And finally, the Southeastern Health Board has worked with many partners on a project called Global Tour, Exploring the Hearts of Our Communities. And it's a partnership with the RCMP, the Boys and Girls Club, Public Library, Community Justice Society, and Schools Plus. And its main purpose is to address stereotypes. As we heard Dr. Hawes say, Dr. Williams made it very clear in his presentations that stereotypes have a very negative impact on people's health. And in the communities where I work, there have been generations of tensions, stereotypes that have been building up between the Black and white communities. So as a health board and as community organizations, what we do is we take 10 students from grade 9 and from the 10 students from grade 9 from 5 junior high schools that feed into Cole Harbour and Auburn High. And we tour the students. We get in a bus, and for 3 days we travel to the different communities. For the first day we're in Cherry Brook. We're in the historical church in Cherry Brook. The next day we go to North Preston, where we have a tour of the community, and we hear from speakers in each of the communities. And so the students love this program. It gets them out of school for one thing, but also they told us that they don't get to see each other's communities, so this is a great way for them to learn and to think about what they know about the other students. And what's really unique about this project is that it is facilitated by high school students. So we have students from Cole Harbour and Auburn High who get some leadership training and facilitate the 3 days with the junior high students. And so just in a conversation recently with the vice principal of Cole Harbour High, after seeing a video which we produced, and we produce a video each year as well, he says he notices that there is those students that he sees in the video that he knows has been involved in the program, that they do hang out in school, and there is a different feeling in the school, so some success there. And we just heard that we have funding for this year's program and have hired a part-time staff person to coordinate it. So just to wrap up, I highly encourage you to connect with the community health boards locally if you haven't done that yet. And for one thing, we have some funding that you might be able to access for any projects you're working on. But also another reason to connect with us is that we can link you to various partners in the community and to other parts of your community and diverse organizations that you may not be aware of. And then finally, we do love to partner with organizations to address health inequities. So please be in touch with us during the day. Thank you.
Thank you, everyone. What a great way to get together and learn about what goes on around us that we don't know often around the day. There's time for a few questions, so I welcome anyone with questions.
Hi, my name is Maura Donovan from the IWK, and I'm curious about the process of different partners and organizations bringing resources to the table and the negotiations around that. And processes around that. I'd love to hear a bit more about your learnings from that.
Getting resources is always a challenge. Thinking about the global tour in particular, each year we have to seek out funding from different organizations, because a lot of organizations don't want to fund projects year after year, so every year we're looking for funds from different organizations. So I guess it's just kind of knowing who's out there and who's providing resources, and again, that's a benefit of working collaboratively with others, because if you have RCMP around the table, they know some funding areas about the foundation, the RCMP Foundation. Boys and Girls Club has a national office where we've gotten funding from. So benefit of collaborating is kind of partners coming together and kind of pulling money together that way. Does that kind of answer your question? Is that what you were looking for, Maura?
That was very helpful and interesting. But I was thinking more around that whole thing when people have turf versus trust.
Right.
That part of the turf is the resources. So someone might have a staff member or a part of a staff member, or they might who they could lend to an initiative, and are they going to see that as an option, or there may be actual cash. It depends on who all the different partners are, and so I'm just curious about that process of who comes to the table with money and how funds are accessed, even from within the groups themselves that are involved, or accessing funds from a group, like a large group that someone's affiliated with, and just, well, I mean, the Boys and Girls Club, that would be an example of that, or the RCMP Foundation, but yeah, so more of that kind of thing.
Do you want to say more? I'll just add a piece from our perspective, because you have raised, you put your finger on one of the most problematic areas when it comes to collaboration. And I think the recognition really is that you need to build that bridge of trust before you kind of go into, who is going to give resources or not. From our perspective, once you've built that trust to say, okay, we're going to work together for common good of our community, and it's not about me taking resources from you or you taking resources from me, then I think that allows you to kind of look at your resource sharing in a kind of better light. One of the things I'd highlight is some of the funding organizations now recognize the strength of collaboration and insist that when you're coming to the table with an application, that you have a list of collaborators on your application as well, before they'll even look at your application. So it is a problematic area, and I guess you have to work through it after you kind of get together and build that trust.
Any other?
Okay. I would just echo what Dr. Haza said about the trust piece. I think with the network too, in terms of resources, in terms of information that each of the organizations have, or events that are ongoing, I think that there is a good sense of trust within the network, in the sense that because we have the common goal to work with the health issues of the African Nova Scotian community, that like through our newsletter, for example, those kind of resources in terms of what's going on, like that's a place where everybody feels free and comfortable to be able to offer what they're doing, and to be able to promote it in that sense and encourage other people to join on, kind of thing like that. So I think with the teamwork in that sense, the trust is there. And then I would speak from ABSW, who I'm the outreach social work for, and HAWK, for example. We do a lot of projects together where there's big funding that's come in. For example, the IWK project we just finished, and that was truly a collaborative project. It was under HAWK, but we were side by side in that the whole way, and it was a very successful project. But again, it's that trust. That was how we were able to kind of do it together the way that we did it, and it wasn't like a competition or HAWK owning this project and ABSW, you're only limited to certain things. We were a partner on it, and it was truly a partnership, collaborative project.
Thank you very much, Dr. Haas, Anna, and Regine. We really appreciate you sharing your collaborative practices.